Hello everyone, I'm Dr. Tiffany Tan. I'm a dentist at Dental Designs Clinic, and this is another episode of Before and Beyond, where I talk through patient cases specifically relating to Invisalign treatment. And today I have a case here which I wanted to show you. And this is a patient, as you can see on the screen. This is a patient, as you can see on the screen, has the condition where the teeth are not straight. There's a bit of crooked or overlapping teeth at the front. The jaw as well is a little bit not symmetrical. It's a bit narrow on the sides. So you can see it sort of turns inwards if we look at the side of it. And also the bottom teeth are not straight. So bottom teeth actually they show when you speak. So they do matter as well. And the back teeth as well, they are slightly rotated. So I wanted to show this case because as we look at the before photo, the concern that the patient had as well was that her smile was too wide. It looked like she had too much teeth. And she didn't like that sort of perception. It was also because the teeth were slightly jutting out of her mouth. It's overlapping the lips. So it gives the impression that because she's very petite, she's got very small features, the teeth sort of look out of place or disproportionate with her face. So that was something she really wanted to change. And with Invisalign, we get all the records, we send it into Invisalign, and Invisalign proposes something, and which I'll show you. So this is the proposal from Invisalign, and I think immediately you can see it doesn't look very ideal because although the teeth are straightened, as we can see here on the right side, this is the before, this is the after. It is all straight, but on the face itself, this is not going to look very nice. You can see that these teeth look like they are jutting out a bit more. There's a bit of a gap here. There's a lot of gum showing on this tooth, and this tooth is a lot shorter. So it just doesn't look very proportionate, even though it's straight. And this is what I always see when I get my Invisalign sort of treatments back, that it is not very ideal sort of aesthetics that they've planned it to. Because again, they are technicians that, they just look at the teeth, it's straightened, that's it. But as a Invisalign dentist, as a dentist, I'm looking at you during a consultation. I'm looking at how, when you speak, how your lips move, how the teeth are shown, things like that. And then we can really try to move the teeth to be straight and also to make sure that they look good in your face, that they sort of look good from all angles, and it should be something that looks really nice for you. So on the right side, you can see these are the plans that we've gone through, and this is the default one. There's also an option for restorative. That means to correct the smile with something other than just Invisalign. So we could put, maybe I'll turn that on again, sorry. We could put some restorations on, kind of like veneers or some fillings that cover the whole tooth to lengthen that tooth. And it does look better. It fills up all the gaps between the teeth. But that can be an option for some cases where the tooth is really, really broken down. But again, it doesn't take into account that gum there is still showing quite a bit. And I had a chat with my patient. She didn't want to do any restorations. So it's going to be just aligning the teeth. And I want to make sure we can achieve a look that looks the best without any restorations. So that's the challenge. And then there's another plan that I adjusted based on the first plan that was adjusted. After I saw the first plan, we adjusted that. Still, a bit better. Oh, sorry, I'll just turn. Yeah, a bit better, but not as bulging out, but still not ideal. So again, I put in some changes to Invisalign, and then that is looking a bit better. And then we go through another change to adjust some parts of the shaving and some of the back teeth there. And then again, there's a bit of back and forth. So it goes to Invisalign, the plan comes back with my changes. I look at it, I change more things, and then I send it again to Invisalign. And then that goes on a few more times. And then this is the final sort of one that I will present to the patient. Oops, sorry. Clicking the wrong thing. So again, this, you can see the teeth look straighter, but the gum looks a bit better there. You don't see so much gum. And the tooth still looks straight, and it's also less sort of bulging out compared to where it was before. That was the before. So we will present this. And actually, now that I'm looking at it, I want to change more things. So this is something that I do every time I look at the Invisalign plan. I sort of look through everything again and make sure everything looks as good as it can be. And so we've got a very small tooth there and a bigger tooth there. I want to make sure that in here, what I noticed was this tooth looks a lot bigger than the back one. So I want to tuck this in, and then it doesn't overshadow that. So it still looks like it's a, you can see all the teeth at the back if you look at it from the side. Yep. And also the other thing that I noticed is this tooth is a bit longer than that one, like the neighboring, its neighbor on the other side. So I will probably push it up a bit more, tuck it in slightly, and then that tooth as well looks a bit tilted. So we would want to straighten it a bit more, push it down a bit, and then we see how it looks like in the mouth. And I'll put a side by side in a minute of, yep, so that looks a bit better already. You can see that's pushed in a bit, so it doesn't look as outwards as before. Yep. Okay, and so I'm quite happy with that. Then I put a side by side because then we can see that was the original proposal from Invisalign, and that is after the adjustments I've made. Then that's the difference. So I want to, the reason why I want to do this is not because I want to say that the Invisalign proposal isn't good. It is straighter teeth. It has done sort of, what the bare minimum is. It has done its job of straightening the teeth. But there are nuances in the smile and things that we can move around that can make the smile look better, that can make the teeth look better. And these things may not be apparent in the simulation, but they really should be detected before we start the treatment and then plan for. And I think that is what sets a clinician who's looking at these sort of things in the smile to make the smile better, and also with somebody else who's just straightening the teeth and sort of not looking at all the finer details. I think that's what sets that apart. Right. So again, The simulation is not perfect, but it's a very good guide of what we should or can expect in to achieve after Invisalign. And of course, I would say it's a Invisalign treatment is also not just a plan and forget sort of treatment. There are many factors that go into ensuring the treatment goes well. And also, some teeth may not move as desired. Sometimes it doesn't move the way we want it to. And then we might have to try a different way of moving it. So also we call it staging, the way we move teeth, like maybe certain teeth move first and then other teeth move after. That sort of staging or planning of what goes first and things like that. That is also a unique strength of Invisalign. We can control many things with Invisalign. So I do like Invisalign for that reason. There is a lot of control we have as a doctor over the result. Actually, yeah, this is the after simulation. So you can see this is the sort of original proposal and this is the final one. And some things that are changed is the angulation of the teeth. You can see that's still slightly sort of angled outwards, but I've made that move in a little bit more. So that improves that original concern of the patient where she felt her teeth were more too outwards. By moving them in, it doesn't look that like it's overlapping her lips, like it's bulging out of her teeth, her mouth. Also, certain angles, I think maybe you could see that is more sort of well aligned to each other. And yeah, maybe just like the lower teeth as well, sort of more, just looks a bit straighter. Unfortunately, in this case, these two teeth are a lot more worn out. There's a bit of a grinding problem happening, so some teeth wear out a bit more. And in this case, it's the front right side. These two are a bit more worn out, so they are shorter than the ones on the left side. And you do see that in the gums. But again, the patient doesn't want to do any restoration, so we have tried to match it to sort of the top of the teeth, and the gum line is usually not visible because the lip is covering it. So the top of the teeth for the bottom teeth is the more visible portion. And so in this case, we've aligned that so that will look straight as we for the patient. And also at the end of it, things that are like this, like slightly sort of higher or a bit more uneven, we can just smoothen that just a little bit at the end of the Invisalign, and that will look a lot better in real life. Oh, the other thing that I've done is also like this black triangle. Again, this is where there's a gap between the teeth. I have done a little bit more shaving there just to close that up, and that also helps to push the teeth inwards. So little details like this matter a lot in planning the final smile. I hope that was useful and helpful, and yeah, if you would have any cases or types of teeth positions or teeth crowding, overjet, overbite, things like that you would like me to go through, and please let us know and I can go through that as well next time. Thank you very much for your time. Bye.